We all want to look as young as possible as we age, and plastic surgery is one of the rising trends to accomplish that goal. But how do you know if it's safe? Dr. Michael Kim is joining us in the studio now to tell us more about how to make sure that your procedure won't land you in even more trouble. Good morning, Dr. Kim.
Good morning.
Thank you for being here. And this is a major issue for a lot of places. Not every plastic surgeon or surgery center is created equal.
Yes, I think that it's more prevalent on the east coast of Florida, but you know, people research their doctors, but they often don't research where the surgery is going to be done. So I think it's important to educate people that it's really important where the surgery is done in a safe place. And if you go to a board-certified plastic surgeon, of course, they are responsible to do that surgery in a certified OR. But as you see in the picture on the upper right, you know, the operating room can be done anywhere, in the office, et cetera. In the state of Florida, remember, any physician can do any procedure in their office. But once you enter the realm of anesthetic procedures, we're talking about larger procedures, not small procedures. You have to be worried about more safety issues. So it's the major issues are, you know, infection, sterility, control, making sure the right site surgeries, certain procedures, types of anesthesia are certified. And so that if you go to the next slide, there are several boards that are looking over these operating centers, and basically the main four ones are JCAHO on the bottom, which do most of the hospital surgical centers and hospital ORs, and then you have Quad AAA certified, which are usually office surgical procedures, and then the other ones are AAA-HC and Medicare state facilities, which are also certified. So those are the main accreditations you're looking for when you're using an operating room.
Are there certain things that we as patients should be looking for when we're seeking out a surgical center that would be red flags if the place isn't accredited?
Well, I think number one, if you're not going to a plastic surgeon, you're going to a family doctor or another kind of doctor, they start talking about doing it in the office, under local. You know, you might wonder about breast augmentation, for example, in the office. It's a little red flag. No surgical center fee. They may not have privilege to do their procedures in the hospital. And you might be, like, for example, seeing a family doctor or oral surgeon doing a breast augmentation.
Seems odd, right?
Right. So, and obviously they can't get privileges usually in the hospital to do those procedures. So it's really important to do the research, not only a surgeon, but where it's going to be done.
We've talked about this before. There's a major difference between a cosmetic surgeon and a plastic surgeon, correct?
Yeah, basically, cosmetic surgeon is any surgeon or any doctor that does cosmetic surgery. And a plastic surgeon is a board-certified plastic surgeon doing a residency that's accredited by the American Board of Medical Specialties to do plastic surgery. So they're rigorous training, rigorous testing to become a board-certified plastic surgeon.
All right, Dr. Kim, thank you so much for this information, and we'll put that on our website as well, winknews.com. We're going to be right back with a check of your weather and traffic and a look at this morning's top stories. Your time right now is 8:24.